Whitney, Tanya, what are some of the trends and placements that you're seeing at AMN?
I mean, from my standpoint, need for specialists in general has increased. So peds, endodontists, periodontists, lots of periodontal disease in the United States. So needs for specialists has gone up. And back in the day when I started doing this about 13 years ago, it was very common to have FQHCs in rural areas reach out to us and want our help. I mean, that made sense because of their location. We have DSOs, like the physician and dental shortage has gotten to be so significant now. We have DSOs in large metros that are reaching out to us for our help. So I think that just goes to show that, the need is not just in rural America with FQHCs. We actually have, similar needs in some of these more metro and urban areas with private practices and DSOs alike. So I'd say that the dental shortage is large and just continuing to get larger.
Yeah. Thank you so much, Whitney. Tanya, what would you add?
Whitney mentions pediatrics, and it feels like pediatric clinics are on the rise, and our clients are expanding into this area with specialized pediatric clinics. So we do see that. What we do with our clients is get creative, and we've been successful in these pediatric clinics finding general dentists who specialize in pediatrics. So we have a large supply of general dentists who really enjoy working with children, and they just move from clinic to clinic where they can get to 100% work with children, and they're not specialized pediatric dentists on paper, but they actually can perform all that's needed in that pediatric environment. The other trend I see is just the broader growing use of locum tenens in the workforce on the day to day, right? It seems like you could use contingent labor only on an emergency as last resort. But what we're seeing is and you heard from Melanie, just the embracing of contingent staff is a really good, solid backup plan, that these folks can become a part of your environment, your community, your team, whether they're there or not. We always find that our relationship, our partnership with our clients, even when we're not actively staffing them, is just as important as when we are, because we're ready to go. And flex staffing, I can think of scenarios where clients don't need a full FTE, and so they don't need the cost of hiring and bringing on and benefits and salary of a full FTE, but maybe they just need someone that can flex up. Maybe they need them sometimes 2 days a week, maybe sometimes it's a full-on 5 days a week. But when you're in a state, that flex staffer, that dentist can actually work for across 3 different clients. And so when you think about the shortage and solving the shortage, if clients can realize, there's a component, maybe 10% of my staff, if I can have them as flex, then I probably have greater access to fill that. And then we have greater access to put dentists to work across a variety of clients to fill their schedule. So just the broader acceptance and use of locum tenens for dental staffing is what I would say.